Hi, I'm Nicole Cutler, a licensed acupuncturist and a holistic health advocate. I'd like to talk a bit about hepatitis C, an infectious disease caused by the hepatitis C virus. Even though it is the most common cause of chronic liver disease in the U.S., the most common blood-borne infection in the U.S., and the #1 reason for liver transplants in the U.S., many either don't know about hepatitis C or mistakenly assume that this virus could not possibly affect them. Unfortunately, this misconception has delayed the diagnosis for too many people. At least 4.1 million Americans are currently infected with hepatitis C. For comparison's sake, slightly over 1 million Americans are infected with HIV, the virus that causes AIDS. Both HIV and hepatitis C are spread by blood-to-blood contact, but hepatitis C virus is approximately 7 times more infectious than HIV. While the primary ways hepatitis C is transmitted are from blood transfusions from before 1992 and the sharing of intravenous needles, the source of infection is unknown in a third of all hepatitis C cases. Once a person's blood is infected with the hepatitis C virus, it enters the cells of the liver, then uses its genetic material to replicate so that it can infect more liver cells. Hepatitis C has been referred to as a silent killer because many don't have any symptoms for years after becoming infected. When vague symptoms like fatigue and abdominal pain finally do appear, the disease is often quite advanced. Because many with hepatitis C don't know they are infected, the disease is often unknowingly passed on to others. The only way to know whether you have hepatitis C is to get a blood test for hepatitis C. Because it is difficult for the body to clear hepatitis C, about 85% of those infected develop chronic liver disease. As is the case with any type of chronic liver disease, hepatitis C progressively damages the liver. First, the disease causes liver inflammation. As the liver tries to fight the hepatitis C infection, it becomes inflamed, tender, and enlarged. Eventually, an inflamed liver will scar. As more scar tissue is created, a decreasing amount of healthy liver tissue remains, and thus liver function declines. Normally, a healthy liver is able to repair small scars, but the repeated damage caused by the hepatitis C virus can cause the liver to become so scarred it loses its restorative ability. When the liver becomes so scarred that it loses its ability to function normally, a person has advanced liver disease. Known as cirrhosis, this severe scarring of the liver is the third most common cause of death in Americans between the ages of 45 and 65. Currently, there is no guaranteed cure for hepatitis C. The available Western medical treatment for hepatitis C has a relatively low success rate and can have severe side effects. Until better treatments are devised, many infected individuals get the best results with a combination of Western medicine, alternative medicine, and lifestyle modifications. Because hepatitis C is passed on so easily, often goes undiagnosed, has already infected so many Americans, usually causes chronic liver disease, and does not yet have a guaranteed cure, hepatitis C is a major public health issue demanding everyone's awareness.